During the history of modern-day medicine, there was a time when physicians strongly believed in mind-body dualism, stating that mind and body are separated and would not affect one another. This was around 1,500 years long after Juvenal's famous mens sana in corpore sano that assigned a relationship between a healthy mind and a healthy body. Later, the concept of dualism is becoming more inadequate as medical knowledge grows and concludes more proof that support the holistic approach of human functioning. Let's look at the most common problem in this fast-paced modern life: stress. In the short term, stress is actually beneficial because it activates our fight or flight response and therefore increases our mental alertness. Yet prolonged stress contributes to physical problems, where some of them, such as arthritis and heart disease, may in turn worsen the mental health of the sufferer in the form of anxiety and depression. Leg amputation, either due to traumatic events or physical diseases, also affects the patient mentally, inducing other stress-related problems and delaying the recovery process, thus creating a vicious cycle between the body and mind problem. This undeniable proof evolutionizes the mind-body relationship, which brings us to mind-body medicine, or MBM, and psychosomatic medicine. While mind-body medicine uses mental and behavioral techniques that focus on stress regulation, exercise, meditation, and relaxation, psychosomatic medicine focuses on an assessment of factors that affect one's illnesses and integrates psychological therapies accordingly. It's not only taking the mind and body into account, but also the social context surrounding the patient. The concept of psychosomatics are characterized by the presence of damage to the organ or organ system of the patient and/or the caregiver family that is triggered by repetitive psychosocial situations. Psychosomatic medicine and mind-body medicine are considered as part of the integrative medicine concept, where it seeks to understand the thorough cause of patient symptoms and use physical, spiritual, emotional, and mental means for treatment. Several examples of integrative medicine include herbal medicine and herbal supplements, such as garlic as antioxidant and inhibitor of neuron damage, and ginkgo biloba that helps improve memory and cognition and becomes part of therapy for schizophrenia patients. Certain professionally supervised types of diets, such as Mediterranean dietary patterns that promote good gut microbiome, reduce the marker of inflammation and risk of depression. Some therapies, such as cognitive behavioral therapy, helps in treating depression, chronic pain, and chronic fatigue syndrome. Reiki, yoga, and Tai Chi help relieve stress and pain. Now that we understand how the mind and body are integrated into medicine, we can start making guided efforts to maintain our health. Many people think that not suffering from any physical illness is enough for their health, but in fact, to be healthy does not only mean having a sound body, but also a sound mind. To manage our physical and mental well-being, we can use the BERN framework from mind-body medicine. B. Behavior, which includes doing pleasurable activities, social interaction, and getting support and love. E. Exercise, meaning doing physical activity. R. Relaxation, including sleep, spirituality, and meditation. And N, or nutrition, which means to keep a balanced and healthy diet. Committing to this framework is not an easy thing, but do it anyway and see if you can prove the mens sana in corpore sano yourself. Thank you for your continuous support, especially our valued patrons and members who have been encouraging us to keep producing more quality content.